Hello, world and universe. Welcome to the Trevor Donald Experience. Manifest your truth. And if you're new to the channel, please hit that like and subscribe button. And for all my continued followers, I want to say thank you. And this is an opinion-based video channel where I try to open your eyes and ears up to some of the travails and tribulations that take place throughout our cities, our states, our country, and sometimes around the world. And we got to get into this story that took place back in September, where the state of Florida became the first state to end vaccine mandates for children to go to school. And what you will see many times for how state laws become federal laws is that if other states after Florida start to follow Florida and start to end vaccine mandates for children to go to school in other states and follow this same mantra as Florida, you will end up seeing that it could possibly become a federal mandate where all schools in America could end vaccine mandates. So Florida is initiating it, and we're going to have to see where this thing goes. You also have to know and remember that Robert F. Kennedy Jr. has been shaking up things in the Trump's administration. They've been falling out with the directors of the CDC and other alphabet administrations under the federal government. There's been a big uproar and controversy going on. And of course, President Trump and Robert F. Kennedy Jr. are against vaccinations, which is very, very controversial. I think that, in my personal opinion, if vaccines are needed, like polio vaccinations, measles vaccines for children, for sure. And if this mandate in Florida takes effect, I think you're going to start seeing many kids get sick, miss school, and ultimately you could see an increase and an uptick in young children possibly dying from some of these diseases that could be prevented through vaccination. Those are my personal opinions. So let's get into what's going on in Florida. What does it mean for Florida, the state of Florida, to end vaccine mandates, and what could that mean for the rest of the United States? Florida Surgeon General made a surprising announcement that the state was moving to end all vaccine mandates. Dr. Joseph Ladapo said the Florida Department of Health would be working with Governor Ron DeSantis' office to end all mandates in state law. DeSantis noted that some vaccine mandates would be removed immediately, while others would require legislative intervention. Dr. Ladapo said that parents should be able to choose what vaccines they want their children to receive or not receive, or not to receive. In a statement to ABC News, the Florida Department of Health said the rule change will go into effect 90 days after September 3rd's announcement, and will include the removal, and listen to this very clearly, whether you're a parent or grandparent, it will include the removal of immunizations requirements for the hepatitis B vaccine, chickenpox vaccine, Haemophilus emphysema type B vaccine, and pneumococcal conjugate vaccines. Other vaccines, including the polio, diphtheria, tetanus, pertussis, measles, mumps, and rubella, will remain in place unless updated through legislation, according to the state Department of Health. So what are some of the doctors, some of the pediatricians saying about this new act that is taking place in the state of Florida? Several pediatricians and public health experts told ABC News that high vaccination rates and nationwide vaccination campaigns have led to the eradication of diseases. So vaccinations have led to the eradication of many diseases, such as polio, and a low number of cases for other diseases compared to decades ago. They said the removal of these mandates, including those required to attend school, the removal of these vaccines will likely lead to more infections, hospitalizations, and even deaths among children. This is what pediatricians are saying. What population? The population of susceptibility in children. Dr. Alok Patel, a pediatrician at Stanford Children's Health and an ABC News contributor, said the short-term impact of Florida removing mandates will be a drop in vaccination rates among school-aged children in the state. Currently in Florida, about 89% of children entering kindergarten have received routine childhood immunizations, according to data from the Centers for Disease Control and Prevention, the CDC, for the 2024-25 school year. Dr. Patel said we potentially could see that number go even lower. When we remove a mandate or when things are not deemed as required, you may have vaccine hesitant parents look at that and say, okay, great. I don't need to actually do that, get these vaccinations for my children. He added that removing the mandate makes it easier for children who have barriers to access, such as lack of insurance or living in a rural area, to miss vaccines. If you have parents who have barriers to getting those vaccines, and then all of a sudden they're told you don't need to get them, sometimes the pathway of least resistance is not getting your kid vaccinated, Dr. Patel said. Patel added that lower vaccination rates could potentially set up the return of some diseases, adding that people need to remember that infectious disease is just a flight away. Dr. Paul Offit, director of the Vaccine Education Center at Children's Hospital of Philadelphia, said that because Florida is removing mandates and potentially other states will follow suit, a population of children susceptible to diseases is likely to crop up immediately. He said this is occurring as non-medical exemptions for school-required vaccines among kindergartens are at an all-time high, according to CDC data from 2024 through 2025 school year. You may not see it immediately. It may take a couple of years, 3 years, 4 years before you really see the impact of this, Dr. Offit told ABC News. I think that's where we're headed. Children being susceptible to these diseases because they are not vaccinated means many kids will end up getting sick, hospitalized, and even dying. This is a second and third doctor in this storyline that said the same thing. More kids getting sick, hospitalized, and possibly even dying without getting these vaccinations. He said children are already dying in the U.S. from vaccine-preventable diseases, including measles, the flu, and whooping cough. In Texas, at least 2 school-aged kids died from measles this year, the first deaths in the U.S. in a decade. We've had our first child deaths from measles and flu. You had 266 pediatric deaths from the flu this year, Dr. Offit said. We haven't seen a number that big since 2009, since the swine flu pandemic, and that's going under the radar as pertussis. We have 10 pertussis or whooping cough deaths this year in babies. Last year, for the entire year, we had only 2, and this year, there hasn't been one yet. Public health experts say that states may follow Florida's example, resulting in a patchwork of states, with some having strict mandates and other states having no mandates. He said, I have no doubt that other states will follow Florida's example and make it so that vaccines are no longer mandatory. I think what you're seeing is this sort of, in the name of medical freedom movement, this is the kind of zeitgeist that we are dealing with. No other states have announced such plans yet, but Dr. Patel said more announcements may come if states view removing mandates as politically popular. That's where we're going with this. There's a kick back and forth with Robert F. Kennedy Jr., President Donald Trump and his administration making these vaccinations controversial. And then you have the other side, the more Democratic side, that wants us to continue to get our children vaccinated and even adults vaccinated. This could be a slippery slope towards more decisions that are politically motivated and not evidence-based. Remember, this is all about science and research, not about your political opinion. All 50 states and Washington, D.C. allow exemptions for school-required immunizations for medical reasons, with some states also allowing religious exemptions or personal exemptions, sometimes known as philosophical exemptions. So for an example, like a religious exemption would be like Jehovah's Witnesses. They don't believe in blood transfusions. And that's their choice. Meanwhile, states on the West Coast and several on the East Coast are forming geographic coalitions to offer their own consistent vaccine guidelines backed by evidence, medical evidence, research-based evidence, and informed by major national medical groups. So the medical community is definitely against ending vaccine mandates and allowing kids to go to school without vaccinations. One group called the West Coast Health Alliance is made up of California, Oregon, and Washington State. The state's governor said in a joint statement that they felt the need to provide their residents with consistent recommendations in the face of inconsistent federal guidance and an erosion of trust in our federal health agencies. Additionally, Massachusetts is speaking with nearby states, including Connecticut, Delaware, New York, Pennsylvania, and Rhode Island, to form a coalition of Northeast states that will similarly issue vaccine recommendations in conjunction with guidance from major medical organizations. So listen to this. A CDC report published in 2024 found that routine childhood vaccinations have not only prevented illnesses, hospitalizations, and deaths, but also produced savings in direct and indirect costs. Among children born between 1994 and 2023, vaccines have resulted in direct savings of $540 billion and societal savings of $2.7 trillion. This report says that if states remove vaccine mandates, this could raise direct and/or indirect cost to everyone involved.